There is still so much we don't know about COVID-19. One of those unsolved mysteries is a case of the long hauler.
Yeah, those are the patients who've had the coronavirus but never fully recovered. Fox 12's Marilyn Deutsch talked to a woman who's still suffering 10 months later.
I kept waiting, like, when am I going to turn this corner? When am I going to get better? And it just never happened.
A floor nurse at a local hospital, Annette Gillaspie, treated those with serious cases of COVID-19. Last April, she herself contracted the virus. 12 straight days of fever as high as 103 degrees, chills, coughing, nausea, vomiting, roughly 30 symptoms in all. And worse, most of these symptoms and others continue, including numbness, tingling, brain fog, fatigue. At times, Annette has felt so weak, holding her phone required too much effort. Chewing, also difficult.
The muscles you use to chew, it was just too fatiguing to use those muscles. My jaw would get tired. And when people would speak to me, I would get annoyed because I would have to come up with the energy to speak back to them.
The exhaustion has not gone away.
It's just like when we had the snow days, my daughter had to drag me home on the sled because I just couldn't walk anymore.
Annette still suffers from a racing heartbeat as fast as 200 beats a minute. She has been virus-free for months, yet every day is like a roller coaster because she doesn't know which combination of symptoms she'll have.
In my opinion, COVID doesn't follow the rules. It does its own thing, and you just don't know day to day and person to person what's going to happen.
Before this, Annette was a healthy 40-year-old working mother of 3.
COVID-19 is still so new that there is still so much doctors and scientists don't know. One study estimates that as many as 10% of COVID-19 patients may become long haulers, and doctors don't know why. How long will some have to suffer from these stubbornly persistent problems, and will they ever go away?
We don't know the answer to that.
Providence cardiologist Gluckman is treating Annette. He says the pandemic is a unique situation in modern medicine.
We're learning as much from our patients as, in fact, the science is allowing us to learn. The patients are sharing information with us faster than the science is actually progressing.
Studies of long haulers are going on now, and Annette is participating. Still, all this is not reassuring for folks like Annette, or really for the rest of us as we enter year 2 of the pandemic that's changed all our lives. Some more than others.
I want my life back.
Marilyn Deutsch, Good Day, Oregon.
Annette has gone back to work, but she is not seeing patients and is sticking to administrative work instead. For more information on this story, you can go to kptv.com.